two hospitals in Johannesburg have been heavily impacted by this week's water restrictions. Helen Joseph and Rahima Moosa Mother and Child Hospitals have been without stable water supply for more than a week now, and the impact is devastating. In fact, Joburg Water announced disruptions for about 11 days. For more on the situation on the ground, let's bring in Professor Daynia Ballot, who's the head of clinical medicine at Wits University. She joins us via video link this morning. Prof, it's great to see you. Thanks so much indeed for making time to chat to us. You know, the Daily Maverick in their report speaks about the impact involving terrible infection control and leaving toilets that are essentially unusable because they are extremely unpleasant. How bad is it looking?
So I think that, as you've stated, the problems of lack of adequate water supply impacts extremely badly on the hospital. So not only on the comfort and hygiene of staff and patients. So, I mean, basic things, as you've mentioned, like going to the toilet, being able to wash adequately, having enough water to drink in this extreme heat, and preparation of food. But it's also the lack of ability to keep the premises clean. And in hospitals, that has a particularly bad impact because of infection prevention control. So very basic measures to prevent the spread of infection, and particularly the highly resistant bugs that we are now seeing, is hand washing. So lack of facilities to wash hands is of serious concern in hospitals. And procedures have to be cancelled, and patients have to endure more discomfort than is necessary. So it really does impact on service delivery, but it also impacts on our ability to train students, both undergraduate and postgraduate, because firstly, that's not how we should be doing things. But secondly, patients cannot be properly cared for, procedures get cancelled, and so students, both people who are learning to specialize and people who are learning to be ordinary healthcare workers cannot be adequately trained. So It is of great concern to the university.
Yeah, and you know, I wonder what the impact of that actually is, because my understanding is that, for instance, the medical schools at Wits University and UCT, perhaps other universities as well, actually compare quite well globally, ranked in the top 100. This kind of challenge, should we be worried about the impact it might have, for instance, on that kind of ranking?
So clearly, yes. I mean, in order to compete globally, one has to try and do everything that we can to the best we can. So things that impact on our ability to train students and also to do research, you know, and have an adequate research output can potentially impact on our global rankings.
Yeah. You know, so much attention, and rightly so, has been placed on pressurizing government to exempt hospitals from the ongoing load shedding. I'm sure it's time for us to also speak about an equally precarious challenge around water.
I would absolutely agree with both. We really welcome the government's announcement to exempt hospitals from load shedding, because electricity outages have similar impact on the ability to deliver service and train and teach healthcare workers. So that was a really positive thing, and we would equally support some sort of reliable solution for water supply to all hospitals.
So far, the solution is just providing water tanks to kind of augment the time when there isn't supply. I presume that's not going far enough, is it?
I think Rahima Moosa has a borehole that has been dug by the gift of the givers. I'm not sure how much water that supplies, but something like that, some longer-term sustainable solution is needed.
All right. Professor Daynia Ballot, thanks very much indeed for speaking to us. Really do appreciate you getting us into the picture. Worrying story this. We'll keep watching it for you as it continues to unfold. Professor Ballot is the head of clinical medicine at Wits University.